Hi, everyone. I'm Mikkael Sekeres from the Division of Hematology in the Sylvester Comprehensive Cancer Center at the University of Miami. We conducted a study in which we randomized patients who had either higher risk myelodysplastic syndromes, chronic myelomonocytic leukemia, or oligoblastic acute myeloid leukemia to receive the combination of pevonedistat plus azacitidine or azacitidine alone. 120 patients were enrolled to that study. And at the recent annual American Society of Hematology meeting, we discussed the cohort of patients who had higher risk myelodysplastic syndromes. There were 67 patients who had higher risk MDS who were included in the study. Their median age was about 72 years old. And what we found is that those who were randomized to receive azacitidine plus pevonedistat had a significantly improved event-free survival with a median of 20.2 months versus 14.8 months for those who received azacitidine alone. In this case, an event was considered if a patient transformed to acute myeloid leukemia or died. There was also a prolonged median overall survival for patients who received pevonedistat plus azacitidine at almost 2 years, 23.9 months, versus a median of 19.1 months for those who received azacitidine monotherapy, though this difference was not statistically significant as the study wasn't powered to show differences in overall survival. What we also found is that patients who received the combination of azacitidine plus pevonedistat who had higher risk myelodysplastic syndrome had an improved overall response rate at 79% versus 57% for those who received azacitidine monotherapy, with an almost doubling of CR rate for those who received the combination at 52% versus 27% for those who received azacitidine monotherapy. The duration of response was almost tripled for those patients who received the combination at 34.6 months versus 13.1 months for those who received azacitidine monotherapy. We also found that responses were improved for the combination regardless of molecular abnormality in patients who received azacitidine plus pevonedistat. This included patients who had higher risk abnormalities such as TP53 or ASXL1. In conclusion, the combination of azacitidine and pevonedistat showed improvements in a variety of outcomes for patients who had higher risk myelodysplastic syndromes compared to azacitidine monotherapy, and we eagerly await the results from the phase 3 Panther trial of the combination, which is now fully enrolled and in follow-up. Thank you so much.